Hello, I'm Michael Failings, professor of neurosurgery at the University of Toronto and co-director of the University of Toronto spinal program. So I'm pleased to talk to you about the spinal fellowship training opportunities at the Toronto Western Hospital, University Health Network, the University of Toronto. Just a few words on our beautiful city. Toronto is the fourth largest city in North America with a regional population in excess of 9 million people. It's considered by the United Nations as the most cosmopolitan city in the world. And it's also one of the most beautiful cities in the world. It has a spectacular skyline, a tremendous multicultural vibe. Here on the right, this is actually the scene right outside Toronto Western Hospital. It's the Kensington Market. And these are some images just out in the Toronto area. This is beautiful beaches in Georgian Bay. And this is the gorgeous Algonquin Highlands north of Toronto. And this is where the Spine Fellowship takes place. This is at the Toronto Western Hospital, University of Toronto, and this will give you a sense right here in the circle where this is. So our Spine Fellowship is an integrated neurosurgery orthopedic spine fellowship experience. The full spectrum of spine pathology, degenerative, traumatic, neoplastic, congenital deformity, minimally invasive, intradural, complex cervical is encompassed. There are also opportunities for other areas of subspecialization, including pediatrics, radiosurgery. The program was established in 1994, and over 200 clinical and research fellows have been trained. We are accredited by the CAST group of the Society of Neurological Surgeons, and we're also an integral part of the AO Spine North America Fellowship Training Program, and our fellows can take advantage of the wonderful educational opportunities through this. So again, we benefit from a very large catchment population. We have strong clinical, educational, and research programs. We offer a variety of educational opportunities. The core educational opportunity is a one-year core spinal fellowship program. This is curriculum based. And then we have opportunities for additional focused subspecialty training in oncology, pediatrics, deformity, complex cervical, minimally invasive. We also offer research opportunities, and many of our fellows have done postdoctoral research fellowships as well as research degrees. This is the list of faculty in our spine team at the Criminal Brain Institute, Toronto Western Hospital. This is Anushka Singh, and Anushka is our fellowship coordinator who helps us to provide the fellows with an outstanding experience. We have a wonderful collaborative network at the University of Toronto to facilitate translational research and to facilitate the work that we do. Toronto Western Hospital is an integral part of the University of Toronto Spine program. This is a combined orthopedic neurosurgical program, and I have the honor of working with my colleague, Professor Albert Yee from Orthopedic Surgery, to co-direct this program. And you'll note this recent quote from our colleague Dan Rue from Columbia University from 2018, a very nice compliment indeed. So the UofT Spine program has the principles of integration, collaboration. We focus also on research and on excellence of care delivery. And we have a very extensive faculty that provides a rich collaborative environment. Our administrative team at the University of Toronto includes our program manager, Nadia Jabber. So the foundation on which the UofT Spine program has been formed includes that of collaboration through a variety of disciplines. We have an excellent fellowship training program, which is curriculum based, very strong academic platform with monthly events, including journal clubs, multiple visiting professorships, multiple hands-on, of course, experiences. We have a program which is highly focused on a strong educational experience. This is coupled with a translational research program, and we're also heavily involved in advocacy. This will just give you a sense of the community of surgeons that have been trained at the University of Toronto Spine program. We have tremendous strengths in clinical translational research and traumatic and non-traumatic spinal cord injury, spine deformity, spine oncology, degenerative spinal conditions, spine trauma, outcomes and health services research. And this is coupled with very strong basic science related to neural repair and regeneration of the injured spinal cord. Just to give you a sense of some of the research that has emerged, some of the most important studies in degenerative cervical myelopathy, for example, this 2013 JPGS publication. This is a publication that came out a few months ago in the Lancet Neurology, showing the impact of early surgical decompression for traumatic spinal cord injury. This is a publication of translational research, which also came out in Lancet Neurology, on the use of riluzole in degenerative cervical myelopathy. The work that we've done in myelopathy and acute traumatic spinal cord injury has been translated into guidelines that our group has led. This just gives you a bit of a sense of the diversity of the program at the Toronto Western Hospital and University of Toronto. We'd love to hear from you. This is my contact email, michael.failings@uhn.ca, Anushka Singh, anushka.singh@uhn.ca. And then also, if you want to find out more about the University of Toronto Spine Program, this is our website. Thank you for your attention, and we hope to see you in Toronto in the near future.